Let me start by asking who's in the room. This panel is going to introduce themselves in a minute, but let them know who's in the room. How many Stanford faculty, staff, students? Okay. How many people from industry in the Silicon Valley? Technology. Okay. How many Johns Hopkins alumni? Nice crowd. How many Stanford alumni? There. Okay, great. And how many members of the community? Great, terrific. So it's a very diverse crowd. So the panel is now going to introduce themselves to you. And I want to ask them and begin by asking them a question that Melissa had, why we should care. And I want the panel in their introductions to say why they care. So let's start with Paul.
I was going to say good morning, but I guess it's evening now. Good evening, everyone. Paul Spiegel. I'm a Canadian physician. I worked with UNHCR for running their health and their technical programs for about 14 years, and then 2.5 years ago came back to my alma mater, Johns Hopkins, and I'm currently directing a center called the Center for Humanitarian Health. Speak up? Okay. So I'm currently a professor and directing a center called the Center for Humanitarian Health at Johns Hopkins. And we do education, research, and more advocacy, evidence-based advocacy for conflict-affected populations. You're asking why should we care?
Why do you care?
I spent my whole life doing this, so it's a hard. Why do I care? I don't know. It's part of my DNA, I think, at this point. I mean. I have a strange story where, can you hear me back there or still or no? Okay. I have a strange story where I didn't fall into this sort of work. I was 14 years old in Toronto and I was reading a Time magazine and I saw, it was the first time when Doctors Without Borders was starting and I saw a French doctor on the Thai-Cambodian border and read his story and said, that's what I want to do. And I've never looked back. And so, I care very, very deeply. And the more, and what's happening now with the increased populism, I think it's even more important now, both in academia and as a community, to speak out using facts, I think nonpartisan, but speak out very loudly.
Thank you. Leila.
Thank you. Good afternoon, good evening. I'm Leila Toplic. I'm with NetHope. That is a nonprofit technology consortium of 57 global NGOs, so including Doctors Without Borders, but also IRC, Mercy Corps, Oxfam, Save the Children, the Nature Conservancy. And what we do is bring together some of these global NGOs with technology experts, including private sector companies like Salesforce, formerly Cisco here in the second row, academic institutions like Stanford, Carnegie Mellon, to work with us to solve some of the toughest problems in the world, including the humanitarian crisis, development problems, as well as conservation. My focus area, which is very much connected to why I care in my personal story, is providing access to quality education and dignified work to refugee children and youth. And that's very much rooted in my personal experience of living in a war-torn country that was former Yugoslavia, experiencing going on my own personal journey of leaving everything behind and fleeing on the buses through the war zone, being a refugee in a refugee camp and a refugee school teacher, and then having the opportunity to access both education and work and take a journey through both technology and now working in tech for good space to give back to the people, 70 million people around the world.
And Richard.
My name is Ann Richard. I am currently an adjunct professor at Georgetown University. I'm the Georgetown alumna here all by myself. Oh, look! Where's Saxa? When I'm from a rural area of New York, and when I went to the big city of Washington, D.C. for college, I think I read in the paper, this really dates me, that there was going to be an event on refugees at the State Department that day, and I walked over and walked in, not a lot of security, and Senator Kennedy was talking about the legislation he was involved in, and it was the 1980 Immigration Naturalization Act that had a Refugee Act in it. And many, many, many years later, I was Assistant Secretary of State for Population, Refugees, and Migration at the State Department and was responsible for the oversight and management of the programs that had been called for in that act. And we Americans are the top funder, not you Canadians, Paul, of 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 the statistics of a lot of the great humanitarian organizations in the world, including the UN Refugee Agency. And so I have worked with Melissa, I have worked with Paul, I've traveled with Paul actually, and I've run after Melissa and her then boss, the High Commissioner, and I have tried to convince Congress and the public that money spent to help refugees is a really smart thing to do and a good deal. I was part of the Obama administration, and I got my job in part because I had earlier worked for Madeleine Albright, perhaps one of the world's most famous refugees, and because she fled her home a couple times as a kid, first displaced by World War II and then displaced by communism in what was then Czechoslovakia. And I also got a chance to work with the International Rescue Committee as their representative in Washington. And between the IRC job and then being the assistant secretary, I traveled a lot around the world and met a lot of refugees, although somehow we didn't meet until tonight. And I found that refugees are among some of the most resilient people on earth. And I also found, people ask me, is it really depressing going out and seeing, human beings living in such difficult situations? I said, well, when you come home, you realize how good we have it. Whether you turn on the tap and water comes out and your kids have lots of toys and they're going to a good school. And so I found that working on these programs made me value what I had even more. And so even though there has been a change in administration in Washington, I don't know if you're aware of that here on the West Coast, but and even though I'm now a has-been,
News hasn't come to us yet here.
now that I'm a has-been and I'm an adjunct professor at Georgetown, wandering around trying to understand where these new buildings came from. Georgetown, by the way, fits into a parking lot. It's the Stanford campus, so it's a quaint little place compared to here. So I am continuing to speak and to talk about, to speak out, as I hope you all will join me in doing, to talk about U.S. policies towards refugees and asylum seekers, because I think that we're heading in the wrong direction. And I disagree very strongly with Trump administration policies, very biased, and I'm happy to answer any questions you'd like about sort of what's happening now, what we were trying to do before, where we should be heading instead.
Thank you. Jacob.
Yeah, thank you, Paul. Just to let you guys know, I'm an African, so when Paul asks to introduce, so I'm going to go for 2 hours, and then after that, I will actually answer the question. No, I'm an American now, so I'm going to be brief. But why should I care? There are several reasons I care. I know what is it like to be an orphan. I know what is it like to wander for many, many months and years and living in a refugee camp. So I know I was fortunate sitting here today as Melissa was showing those 29,000 people fleeing, that I could be selfishly just said I'm an American, I'm proud, forget about the refugees. But the reason I care, I know somebody somewhere is like Jacob back in the day. There are more lost boys, whether in Syria or Congo or South Sudanese. There are more lost boys and girls being produced each day. That's why I care. I care to share my story. As many of my colleagues said, that each of us has a story to share. But most importantly, if I don't speak out, who would? And today, it's really special for me. I will try not to be emotional. And the reason I say this to be emotional is Paul Spiegel, uh, many years ago, I was young, when we first got early 1992 to Kakuma refugee camps. I had no idea a few years later he would be my boss at Hopkins. But he went and welcomed the Lost Boys as a young medical doctor back then. But to still see him continuously doing this, it gave me hope. I don't think I have any excuse as a victim not to do that, because Paul could easily have a great life in Canada. I have to say that. The same thing with Melissa. It broke my heart that you just came from Kakuma refugee camp that I live. I left in 2001, so I've been in America at 18 years now. And I still have friends and family calling me from Kakuma refugee camp. The only thing that changed is telephone. Back then, Lost Boy didn't have cell phone. So now they can call me, and I can send them money. But other than that, think of it, 1992 up to now. And think of other refugee places. It's averaging, 16, 17 years? So I have a lot of reason to care, and I hope we can share more tonight. So thank you. And that's my American answer, not African.
Thank you. I want to start by asking Aunt Richard. This week we heard the President of the United States say, we're full. What message does that send to the world, to our friends, and to our allies when the President of the United States says, we're full?
Well, I think it's a very bad message. We set a bad example to some of the populist governments of Europe. Some are in power in Eastern Europe, and some are, running in elections and gaining ground in Western Europe. And it shows them that a great power is making this excuse so that they can too. If we're building walls, they can build walls too. And for me, it's heartbreaking because I know how much the U.S. example is paid attention to overseas. I've been in conference rooms where when it's time for the U.S. person to speak, and I was the person behind the placard that said United States, which was a really heady responsibility, that when it's time for the U.S. Representative to speak, you can hear a pin drop in whatever conference room you're in, whatever the topic is, because people from other governments want to know what we think and what we're doing. I'm very concerned that we are ignoring our responsibilities to provide a sanctuary and to give a hearing to people who are claiming asylum. And we agreed after World War II, with the 1951 Refugee Convention, that we did not want to make the earlier mistake we had done of turning people away who had fled Hitler, who had fled Mussolini, who had fled fascism in Europe, and then later who fled communism in Europe. And we didn't want to make that mistake and turn back innocent people, sending them back to death and destruction and despair. And we are doing it now. And one of the things I've heard White House officials say is that there are people at our borders who are trying to exploit loopholes in our immigration law. What they're trying to do is claim asylum. That's not a loophole. That's not an accidental piece of our laws. That's something that we all subscribe to for decades. So the fact that this is suddenly just sort of jettisoned without a vote of Congress, without a national debate about our own national character, I find that really shocking. I did not see that coming.
Paul, we were talking before, Paul Spiegel, and one of the things, to follow up to what Ann was just saying, one of the things that you mentioned that I found pretty disturbing, and if you could talk further about, is the politicization of aid, the politicization that you're seeing around the world of choosing winners, losers, et cetera, by different governments. Can you talk more about that?
Sure. Some of the recent work we've been doing in Mosul, in Iraq, in Yemen, and now most recently in Venezuela, is showing that aid is becoming more and more politicized, and that the humanitarian principles, humanity is still there, but neutrality, independence, and impartiality is becoming more and more challenged. And it's happening in different ways. Overtly, with the United States promising a significant amount of aid to Venezuela, while openly saying they want a change in regime. And then there are more subtle ways that's happening, which are quite interesting in Mosul in Iraq, where you had NGOs working with the Iraqi military, embedded with the Iraqi military, in order to have their protection, to save more lives. And this is more tricky because humanity saving lives is really important, and they saved many lives, but at the same time, they were embedded with the military, so there were neutrality and independence issues. And this is becoming more and more now, we're seeing in many of these situations, stickier as the Security Council, you see when the Security Council are not agreeing on anything, and the U.S. now is significantly backtracking on...
Your microphone is on that side of you, so just look over there at Paul.
Oh, okay.
You don't have to
Or
make
hold,
that kind
or
of
hold your
request.
mic.
You're mesmerizing. So when the U.S. is when the U.S. is backtracking on as Anne is showing in their leadership, it is easier for governments and for even certain NGOs to come in and not necessarily fulfill the humanitarian principles, and that's becoming more and more disturbing. And I will add also just to say that the healthcare workers, hospitals are being openly attacked now in Syria and Yemen. This had not happened to the same degree.
What is the trigger to that? What is there a common trigger at place here?
I think the common trigger now, at least, is it's much more in a political nature now, where the center is not holding anymore, and I think governments are becoming more and more emboldened. I think also the warfare, the nature of warfare is changing. We're not having governments fighting governments. We're having a significant amount of terrorism occurring. So the unipolar way of fighting is allowing people, I think, to go over and not necessarily follow the humanitarian principles as they would have in the past. And we're seeing this, certainly ISIS, Al-Qaeda, the Taliban, the way that the fighting is occurring, a lot of the principles were made, and even humanitarian aid and the whole system was made post-World War II based on governments fighting wars and not this sort of warfare, which is again challenging some basic principles.
Leila, you just returned from Jordan. Can you talk about and you were dealing with refugees, with NGOs. Talk about your experience, what you were doing there, what you found. Give us sort of a report.
Absolutely. And maybe to give kind of the other side of the coin, which is and talk about some of the encouraging trends that I'm seeing in the work that we're doing. And at NetHope, I lead the work that brings together over 70 different organizations, including UN agencies, NGOs, private sector companies, startups, academic institutions, all focused on collaborating and coordinating around providing access to quality education, dignified work, protection, and participation or voice to displaced populations as well as host communities. As Melissa noted, over 85% of refugees are based in places like Jordan or Turkey or Lebanon, places that actually don't have enough infrastructure for their own population. So it's very important in the work that we do to be inclusive and to encourage integration. And the two encouraging trends that I'm seeing that have very little to do with the governments, one is that the companies, private sector companies, large and small, startups and established, are coming together to help the refugee population, both here in the U.S., whether it's through hiring practices, for example, but also where most of the refugees are located, so in places like Jordan.
How has this coalescence come together of these organizations?
So it came out of the need to coordinate the response and to ensure that the needs are met and that are met in a sustainable way. As Melissa noted, majority, about 2/3 of refugees will spend on average 16 years in displacement before they can either resettle or return home. That requires a lot of coordination, both to meet the immediate needs, but also ongoing needs, which includes education, employability, and also protection. So just to mention another encouraging trend. So there is the private sector companies and the role that they're playing in helping, in supporting UN and NGO agencies, but also bringing their unique expertise, whether it's technology or other like supply chain expertise, hiring expertise, skills training, and so on. The second part is advances in technology. When I was a refugee in the mid-90s, I discovered technology for the first time in a very unlikely place, which was a refugee camp. And keep in mind, in the mid-90s, that was way before the cool devices, apps, even World Wide Web. But I fell in love with those big beige boxes in Windows 95, which led me to study technology later and work in this sector and do what I do today. Technology that is available to us today, including some of the latest and emerging technology like artificial intelligence, is enabling us to meet the needs both at scale and also in a personalized way. And also it requires the UN and NGO sector to work together with the experts in technology to both adapt the products that are being developed here in Silicon Valley and to develop net new technologies that could help meet the needs at scale.
Jacob, I want to ask you to go back to your personal experience and talk about that. When you left Sudan and you left South Sudan, you were out tending cows. You escaped because you weren't in the middle of the warfare. When you left, talk about that experience. How does one keep... At one point, your brother was carrying you on his back. You were walking hundreds of miles. Let people know what that experience is like to be displaced, be thrown outside, to have your family all killed. Talk about that.
Thank you, Paul. So the Sudan Civil War started, well, the first one was 55 to 72. Then you have the 83 to 2005. And that's the war that really uprooted my family, that has killed my relative. 2.5 million people have died in that war. I hope you can hear me. Okay. So 2.5 people died in that war. So I live in a small village called Mar, which is in Jonglei State. It's in the southern part. I don't know about you. Anybody cow lover here? Anybody like cows? No? Okay, good. Oh, well, my fellow Sudanese here love cows. So that was my job. My job is tend the cattle, especially look at after the calf. Life was beautiful. One of the things that Melissa noted is that home is home. You may see some homes with huts and with what is not a nice building like Stanford, but home is home. And that's what happened. When that home was obliterated by the Sudan Armed Forces, the regime at that time, I lost everything. And I was really, really young. When I say young, I was about 6 or 7 years old. And I was not born in a hospital, so I don't have a birth certificate. And not only that, my cousin Michael was the one that carried me. So one day became 2 days, and then it became a week. And I keep asking, Michael, are we coming back home? Turn out, no. And the next thing I know is walking to this country called Ethiopia. But let me describe the walk. It was not an easy walk. You are facing so many things. It's not only your village is obliterated, you are now worried about so many things. One is the militia is still coming after you. They got the old Russian-made antelope. Then you have to worry about clothing. You have to worry about walking. And I travel a lot. I was just speaking to the Marines a few days ago, and I would ask the same question and answer me genuinely. When was the last time you happened to drink your own urine just for the sake of it? You don't. When was the last time you drink your own urine? So the reason I say that these are some of the things that we had to go through, or you have to drink unclean water that to make your throat thirsty. Now, fast forward, we finally made it to Ethiopia, and in Ethiopia, it's a good news and a bad news. It's a good news that we are refugees now. Nobody can attack us. It's a sad news now that communicable diseases are coming up, like whooping cough and a lot of diarrheal diseases, and a lot of people, lost boy, died. But there's one instant, it's called River Gillo, that killed over 2,000 people in that river. And that river is the most casualty of the lost boys. Everybody remember, I was really young. And so every time we walk, there's more death. I think it's estimated to be 27,000. And it was reduced by the time we came to Kakuma refugee camp to 12,000. And about 4,889 made it to America. Okay, so you can see a lot of people lost in the walk. But every time you have to walk, the ages ranges between 5 and 17 and 16. So we have witnessed a lot of atrocities. Your relative being killed. You have to grow up as an adult overnight because you have to see a lot of death. And then you constantly fear, is it you next? You see your colleague walking, they get shot, they're dead. You don't even have a proper time to have a proper burial. So a lot of us have seen death from early age. And I remember when we got here, CDC, we were diagnosed with PTSD. And so that's estimated from my village to Ethiopia was 3 months. And then after that, another 3 months tracking to Kenya, where Paul met us in 92, and we stayed there for 9 years before we got resettled. So the journey was very treacherous, and the journey was not that easy, and a lot of people died. And that's the summary I could say for now.
And how do you keep hope? How do you keep some sense of optimism?
One thing with the Lost Boys, when Melissa talked about education, we used to say education is our mothers and our fathers. I remember I never went to school because think about it. You are faced with either, in today's term, it's called hustling. You either can hustle for the food, something to eat. You have a group of boys in my Jama, they call it Jama in Arabic, but then these 6 men, you have to fetch water, you have to have food, you have to be cooking. It's a lot of division of labor. Well, you don't have time to go to school. And what got us together was we grew up as brothers and sisters. That's who we know. And a lot of us have a faith background, and that really, the only thing we could do back then is to sing hymnal songs. But what was difficult, and generous Americans or anybody would give us pencil, would give us things that we don't know. But don't get me wrong, when you really want the hot meal and somebody give you a pencil, it's not their fault, but you don't know. But in reality, I'm like, really? Are you serious? But living in a Kakuma refugee camp before we got the opportunity, it was like waiting for your death. And just hearing about Kakuma now, is still more lost boy there. And so I remember, and maybe you were one of these people who wrote the letter. There was somebody who wrote the letter to the Congress and said, please bring the lost boys here. And I appreciate that person right now, because the person who wrote that letter didn't know what he or she was saying at that time, that we would be contributing to the world today. And this is where the America, I can talk more later, I know that what the refugee need, like me or other people Melissa talk about, it's not money, it's not anything. It's just that opportunity to just say yes. And this is the America I know. I want to give you a kind of a positive look, because the America I know is America where the Congress and both Democrat and Republican actually sat down and agreed the lost boys of Sudan are coming to this country. It was amazing. It was no bickering. But if you ask now, the lost boys are in military. The lost boys are everywhere. And this is the same story with the refugees I know. They work hard. We don't want handout. We just need opportunity, somebody to accept who we are. So thank you.
Thank you. And when you look across the globe right now, where are there possibilities that any conflicts that are ripe for resolution? And are there particular places that you think that people may be able to go home again in the short term?
Yeah, there are too many places, unfortunately, that are in really intractable, difficult, complex crises, long-term conflict, and that's why many refugees are in these protracted refugee situations. I am hopeful that my example was Colombia, that because there had been peace negotiations in Colombia, that there might be an opportunity for all the displaced in Colombia, some living nearby as refugees and many displaced inside Colombia, that they would be able to go home again, resume their lives in a much more stable country. It still has a long way to go, but the peace agreement between the government and the rebels, the FARC, to me was a hopeful sign. Of course, unfortunately, what's happened in the meantime is that 3.6 million refugees have fled Venezuela, and some of them have gone to Colombia. So we now have, unfortunately, we sort of have a one step forward, two steps back situation. Some of the other big crises are ones that diplomats have spent hours and hours working on. Can we bring peace back to Syria? Can there be some sort of negotiation with the Taliban that benefits the people of Afghanistan? These have proven to be really, really tough, difficult crises to resolve.
Did you come to realize, and how hard was it to realize the limits of power? You know, you're Assistant Secretary of State. How did you come to terms with the great American story, the power of, you talked about sitting in these meetings and the authority of America and the power of America, but it's also limited. How did you come to terms with that?
Well, I think that the kind of problems we're talking about are really tough. They're really hard to solve. It's not just that you can create an app and we're done. They're complicated. People have had devastating things happen to them. Assad, for example, the leader of Syria, he doesn't want to step down. He sees it as a lose-lose proposition. And yet we know people won't want to go home if Assad is the leader of that country. And so I think that what's very sobering is realizing how hard it is to make progress. On the other hand, things often don't happen without the United States. The U.S. can make a major difference. It can make when we choose to, we can really get traction. We can convince other countries to join us. We can build coalitions and move the needle forward. And so I've seen that happen. I've seen how U.S. leaders, I'm thinking of government leaders, but also American celebrities, American authors, American movie makers can really influence people far beyond our shores. So I think even though things are hard to do, we still ought to be present, we ought to be involved, and we ought to be trying to find solutions.
Paul, you made the transition to university life. So I'm curious, why did you do that? What was it in a university that you thought could be a powerful asset in really changing, in adding to the dynamic, changing the dynamic, bringing your skills and really making a difference?
Geneva was too dangerous, so I wanted to move back to Baltimore. Like everything, it's a mixture of both personal and professional. The center was originally called the Center for Refugee and Disaster Response, was actually created when I was a student at Hopkins, and a position opened there. And also I felt that when I was at UNHCR, we were trying our best to use the data. But the Syrian, every decade or two, there's a crisis that really just changes everything. And so Rwanda, of course, and then Syria changed so much in the health field of suddenly we're dealing with, it actually started in the Balkans, but we're dealing with middle-income countries And when I was at UNHCR, we had to create, suddenly we had refugees, and we had to deal with cancer, we had to deal with renal dialysis, but we didn't have actually the standards and the protocols to deal with this, because everything was really made for communicable diseases in low-income countries. And so as I started to I had to make a lot of decisions, but I didn't really have the data. And so part of my goal of coming back to university was to actually work on this, to work on the indicators that we can actually use the limited amount, the precious funding that we have, in a much more effective way. And that's very difficult. We're still trying to do it. Technology now is making a big difference. So I would say that was one major reason. The other major reason is that there were so many crises over that 14 years in UNHCR, and we were searching for humanitarians, water sanitation people, doctors, nurses, and it was really hard to find them, actually, which was really surprising, because when I was at Hopkins, I was surrounded by people, and that's all we wanted to do was go into the field. But we were finding a dearth of those people. So my other goal was still to try to help to create to at least nurture the future humanitarians. One thing that I'll say, you asked to be a bit controversial, is coming back, being at Stanford, working closely with Stanford, working at Hopkins, is that, and although there's a huge diverse student body, I want us to be able to work more closely with students in the lower and middle income countries, because I think they, firstly, don't come out with hundreds of thousands of dollars of debt that American students do, but there still is a big difference in how we are reaching and training the people here, and how we're trying to do this or not really succeeding in a place like Juba. Jacob and I were in Juba recently at the School of Medicine, and it was extraordinary to see what a small amount of money and working with them, what we could actually do. But there is not a lot of funds, and there's not a lot of ways to be able to help them in a sustainable manner, at least that I'm aware of. So while I'm thrilled to be back in the U.S. in training future humanitarians, I want us to figure out how we can also do more in the lower and middle income countries. And maybe I'll just end by saying we're working really closely with universities such as the American University of Beirut. But what's fascinating is that many of those folks have been trained in the UK and the US and Canada, but even though they've been going through conflict for so long, they weren't trained in humanitarian. And so we're actually working with them now, and we're exposing them to the way that we do humanitarian health, because they were trained in a Western manner, not necessarily on the humanitarian component.
Leila, Paul just mentioned where we can do more. So I'm wondering, where can we do more with technology? And then we'll close this, and then we'll go to the audience.
Thank you, Paul. And just actually, I'll start by adding a couple of examples of where I'm seeing academic institutions contributing to the work that the UN and NGOs are doing, as well as the young people. One example is we were trying to solve the challenge of providing young people who are out of school. And in the Middle East and North Africa region, over 15 million youth, and actually children between the ages of 5 and 14 are out of school. 10 million are at risk of dropping out. Many of them are actually working in difficult conditions and trying to support themselves and their families. In many of the Middle Eastern countries, most of the refugees are actually not in refugee camps. They're in urban settings, so they have to support themselves and their families. They have to provide for the housing as well as healthcare and food. So that kind of leads me to one of the challenges that we uncovered through the conversations and focus group with the youth, being able to actually access learning anywhere and anytime, which might be on the bus, in the instances where there is no connectivity or power, and it has to be in their primary language, which is Arabic. So we got together with University College Dublin, with Microsoft and the Norwegian Refugee Council, which is one of the members of the No Lost Generation Initiative. And we're building a solution that's actually leveraging artificial intelligence as a chatbot that, together with the youth in Lebanon, that is enabling them to access learning content anywhere and anytime. And it's really accessing the learning content that many of you have developed, and actually companies in the US, so whether it's Microsoft or HP or Coursera. So that's an example of where an academic institution that has the expertise in artificial intelligence, it's actually a professor with a group of PhD students, have brought together the expertise and now are actually in the process of transferring that expertise to the humanitarian agencies that don't have that in-house. Another example is actually with the Arizona State University. Through the conversations with the young people in the Middle East and North Africa region, what they discovered is one of the biggest challenges for them is to learn how to learn online. I think that's a challenge for most of us, learning from MOOCs. It's really quite complicated. If you have low digital literacy, if most of the content is in English, and if you have almost no connectivity and some power, how do you get into this mode of growth mindset and lifelong learning, and how do you learn online? So Arizona State University, in partnership with the Norwegian Refugee Council and with the young people, again, co-designing with the youth, are building a course that will help young people learn how to learn online. So again, an example of how an academic institution can bring the expertise and the resources that you have in-house and support the needs, but first start by understanding the needs of the population that you're trying to support.
Please thank the panel. We're going to take questions from the audience. There's a microphone right here.
Thanks so much. My name is Nicole Southard. I'm a graduate student working with Paul Wise on a number of different projects here. And one sort of repeating issue I see coming up a lot, especially if you're looking from the donor side of things, is their unwillingness to engage in a certain degree of risk when they might be supporting or funding NGOs or other humanitarian actors that have to negotiate with non-state actors or questionable groups that may be affiliated with terrorist networks. And what sort of mechanisms or conversations do you think we need to be having as a group in order to reduce the risk and hesitancy on the part of donors to support those kind of endeavors?
Who wants to take that?
Well, when you say donors, do you mean donor countries? Generally, yeah. Yeah, okay. So there are some countries that are more willing, more comfortable dealing with risk. The Scandinavians have a reputation for that than others. The U.S., we treat our taxpayer dollars as very precious things, and so Congress is very concerned that that there be no waste, fraud, or abuse. And this stems back from the 1960s, where the 60 Minutes program would go and reveal how foreign aid had been wasted, and it was all being spent on pink champagne and big pools and lounging about the pool in Africa. And so there are a lot of controls on what you can do with U.S. taxpayer dollars. I think the scale of the crises in the world today, the number of displaced, suggests that we need more donors anyway. We need more from the public. We need more involvement from the private sector. We need countries that weren't traditionally part of the annual giving, the UN appeals process that is engaged in, countries coming to the table and joining with others in this process. So, for me, I'm not going to try to convince members of the U.S. Congress to loosen up a little bit on the U.S. taxpayer dollar. I actually got my start in government working for the Office of Management Budget, so I think that money is just really precious. But I think it also can cover a lot of the basic things, and that more experimental things can be done by people who are willing, by perhaps private sector philanthropists. I remember Bill Gates Sr. said once that the Gates Foundation could make mistakes with its money, whereas the U.S. government didn't want to. And so, go for it. That's my thinking is, private sector philanthropy, more coming to the table. Do you agree?
I agree. And actually, I do want to expand how we think about support or funding because there's cash. There's also, when we talk about private sector, there's traditional CSR, which is cash grants, employee volunteering, and product donations. And we definitely welcome that as long as it's guided by the NGOs in terms of where the need is, and so we don't end up with tablets being sent to the places where there's no power or connectivity. The second area is business operations and product development. So that is priceless for the NGOs to get that kind of support and also to ensure that people we're supporting are able to get jobs, are able to get training. And the third part is policy and advocacy, so ensuring that those whose voices would not otherwise not be heard are actually heard. And the private sector, so the example that I love bringing up is IKEA. When IKEA was looking to open up a store in Amman, it's between Amman and Queen Alia International Airport, what they wanted to make sure was that the part of the employee base was actually coming from the refugee population too, that was hosted by Jordan. So I do want to encourage us to both think in terms of who the sources of funding are, but also what the support looks like in a more creative way, mainly because of the scale of the crisis and diversity of the needs.